Welcome to the Environmental and Toxicological Emergencies and Communicable Diseases module of this CEN exam review course. This area accounts for 14 questions of the 150 that will count towards your final score. So that's 9% of the questions. I mean, overall, this is, what I would say a smaller area when it comes to number of questions compared to some of the other areas. However, I want to stress that this is one of those areas where a lot of us are probably least familiar. There's so many weird topics in this one that honestly we just don't deal with that often. I mean, how many of you ever cared for a patient with diphtheria or cared for a patient who had a Portuguese man-of-war sting? I mean, yeah, some of us have occasionally, but a lot of these are things you'll go through your whole career and never take care of. So they can be really challenging topics. So even though it's a smaller area on the exam, we are going to spend a little bit of time here, and this is probably worth a little bit of extra time in your studies and preparation. So with that introduction, let's do the first challenge question. Ready? 100% oxygen via non-rebreather mask is initiated as treatment for a patient with carbon monoxide poisoning. Which of the following parameters should be most closely monitored during this therapy? A, serum glucose, B, pulse oximetry, C, urinary output, or D, cardiac monitor? Now remember, I'm going to give you the answer in a bit, so see if you can get it correct. All right, let's start with some toxicology and talk about chemical ingestions. So of course, a chemical is either going to be acidic, pH below 7, or alkali, pH above 7. Now, examples of acids include batteries, drain cleaners, toilet bowl cleaners, and examples of alkalis also include drain cleaners, alkali batteries, and fertilizers. Now, I don't believe this is a big secret, but let me ask the question anyway. Of the two, which is worse for body tissue? Which is more destructive to body tissue, I should say? Acids or alkalis? I'm going to guess most of you said alkali because that is the correct answer. Now, both are not good for tissue. I mean, don't get me wrong. These are both very destructive to tissue. But an acid, when you swallow it, will burn and coagulate all the way down, and then once it's down, it's done. The coagulation has occurred, the damage is done, and the burn is done. Alkalis, on the other hand, when you swallow them, will not only burn on the way down, but they'll continue reacting with tissue as long as 48 hours later and keep breaking it down. So the tissue will just keep breaking down, and potentially the patient can have a rupture of any of the areas that's burnt up to 48 hours later. They can rupture their esophagus, they can rupture their stomach, and lead to secondary complications from a rupture. So that's what makes alkali so much worse. So when a patient swallows these, of course you'll probably see the burns on the mouth, the blistering, the redness, the bleeding, the edema. The patient will usually be screaming with pain. These can be very uncomfortable. They may have drooling and vomiting as the airway swells, stridor, hoarse voice. And with alkali, you always have to consider the possibility of an esophageal or stomach perforation. Not only when they arrive, but even after arrival, because remember, they're going to continue to have damage after the initial ingestion that can lead to a delayed perforation. So you want to watch for a new onset subcutaneous emphysema of the face or abdomen. You want to look for a new onset abdominal distension, a new onset of pain, anything that could indicate that the patient is perforating after an alkali ingestion. Now, the treatment for chemical ingestion is more about what you don't do than what you do. Do not induce vomiting. Your stomach has a pH of around 1.5, especially just after you've eaten. I mean, your stomach is designed for really, really low pHs. So if there's any place in your body to put a substance with an abnormal pH, it's your stomach. Not your esophagus, not your throat. That's very delicate tissue that can be injured easily, but your stomach is hardy. So once it's in the stomach, leave it in the stomach. Do not induce vomiting. In fact, we want to discourage vomiting. And do not give anything by mouth. Now, you sometimes may give milk or water to a patient who's ingested an alkali substance to neutralize it, but only with the guidance of poison control. So you want to check with poison control before you do that. But they may encourage you to give milk or water. But never ever give anything liquid, especially water, to a patient who's ingested an acid, because acid plus water makes steam. Now you have steam in an enclosed space that's going to cause a thermal burn on top of a chemical burn down there, and it just compounds the problem. So a lot of do nots. Do not induce vomiting. Do not give anything by mouth. But there are some things you should do. You should rinse the mouth out with water or normal saline. You should ensure an adequate airway. They can have edema and may need to be intubated. And you should consider analgesia, because these can be really painful.